Hello, welcome to another episode of Yummy Data Science. In this episode, we will talk about healthcare claims and give you a little bit of a background on what they are. So, have you gone to a store to purchase anything? Of course, you have. And if you care to get your receipt, that is an invoice. And say if you go to Target and you buy 10 things, you'll probably see 10 lines on it. So that's your invoice. And if you look closely enough, there will be a date, there will be a transaction ID, maybe an invoice number. So healthcare claims at the very basic are just that, invoices for healthcare services rendered by a provider, so by a pharmacist, by a physician, by a lab technician, by an X-ray technician, um, uh, for patients. And they are generated, these invoices are generated because the purpose is to get paid. Um, and who is paying for them? Well, if you don't have insurance, then it's self-pay. But about 90% of U.S. Americans do have health insurance, and so then the payer is the health insurance. Which actually brings me to this table that I have put, and it gives you some key statistics by insurance coverage. So the total US population is around 340 million, and the insured, they're about 315 million. So it's actually shocking and surprising that we have about 25 million uninsured people in the country who have to, if they have a catastrophic health event, then they are liable to pay for the expenses of those catastrophic life events. Of the insured, private health insurance, most commonly given through your employer, and examples include United Healthcare, it's the biggest one, Blue Cross Blue Shields of various states, Kaiser Permanente. Now, private healthcare insurance is about roughly half of the insured market. Now, a huge player in this market is Medicare, which insures about 60 million people. Medicare has two parts. Medicare Advantage, in which Medicare contracts with a third party, a private health insurance like United Healthcare, Kaiser Permanente, etc., to administer the program, and a Medicare fee-for-service in which Medicare administers the program. So here's a pop quiz for you. Which of the following will generate a healthcare claim? When you pick up your prescription at a local pharmacy, your annual physical at your doctor's office, an emergency room visit because your child broke their wrist, your hospitalization for childbirth and the subsequent stay and for the birth of your baby, a telehealth visit that was done via video, a blood draw for a test, a routine mammogram, or medical equipment for your elderly mom who needs a wheelchair. And if you picked all of the above, you got it right. All of these instances will generate healthcare claims data that will then, it will be generated by your provider, the institution, or the person who provided the care, and then will be submitted for reimbursement from your payer. So some shameless self-promotion here. I have written two books. The first one here, Administrative Healthcare Data, has been co-authored by Craig Dickstein, a mentor of mine. And this book is chock full of healthcare analytical applications, and it uses healthcare claims data to show, to illustrate what the healthcare applications are. And my earlier book is on SaaS business intelligence. It is unfortunately out of print because SaaS business intelligence was a short lived technology, being replaced by a more updated tool set from SaaS. But the book is useful because it is chock full of applications of healthcare data analysis.